The 7 healthiest foods you keep seeing on every senior nutrition list. Most of those rankings count studies never run on adults over 60. The 2024 Tessier paper in JAMA Network Open is the latest example. 92,000 U.S. health professionals followed for 28 years. And the listicle skips the cohort entirely. So we lined the standard 7 up against the underlying research and asked one question per food. Was this study actually done on adults over 60 or borrowed from a younger cohort? 3 of these foods have direct 60-plus evidence. 4 don't. The answer reorders the list. The 2024 Tessier paper, the first to track olive oil and dementia death across 28 years, was published in JAMA Network Open in May 2024. The cohort, 92,000 U.S. Health professionals from the Nurses' Health Study and Health Professionals Follow-Up Study. Baseline mean age 56. Most listicles rounded down to olive oil supports brain health. That gap between what the paper measured and what the listicle reports is the through line of this video. Senior nutrition listicles have copied the same template for 15 years. Olive oil, fatty fish, leafy greens, walnuts, berries, whole grains, legumes, sometimes a different 7 but the same shape. Almost none of them name the cohort. Almost none of them name the mean baseline age of the participants. Almost none of them name what each study did not measure. That's the gap this video closes. The reanalysis pile keeps growing. Aspirin for everyone, walked back. Saturated fat as the sole heart disease driver, walked back. The 8 glasses of water rule, walked back. And now the standard healthiest foods list is overdue for the same kind of cohort-by-cohort audit. The Tessier 2024 paper is one of the studies that triggered this audit. Here's what we did instead. Each of the 7 foods on the standard senior nutrition list got the same 4-question pass. Question 1. Was the study actually done on adults over 60? Mean baseline age, sample size, follow-up length, explicit. Question 2. Was the outcome the kind of thing the audience cares about? Independence, falls, cognitive function, or was it a proxy outcome the study used because it was easier to measure? Question 3. What did the study not measure, and is that gap acknowledged in the listicle? Question 4. Was the conclusion borrowed from a younger cohort and pasted into a senior nutrition list without disclosure to the reader? Who is the cohort these lists were written for in the first place? The 7 entries that follow are ordered by cohort evidence quality, weakest to strongest. Number 7 has the gap. Number 1 has the strongest direct 60-plus signal, with 1 cohort extension caveat we'll name when we get there. 3 of the 7 foods have research built specifically on adults over 60. 4 of them carry strong general adult evidence that has not yet been retested for the cohort that lists like this are written for. None of that means the other 4 are wrong. It means we are inheriting conclusions from cohorts that don't include us, and that is the through line of the next 20 minutes. Number 7. Whole grains. The 2015 WU analysis in JAMA Internal Medicine pooled the Nurses' Health Study and the Health Professionals Follow-Up Study and found that every additional serving of whole grains a day was associated with a 5% lower total mortality and a 9% lower CVD mortality. That's heart and vessel disease. The 2016 Zong analysis in Circulation reproduced the same direction of effect across 2 prospective cohorts. To put that into perspective, this is the most robust whole grain mortality data in nutrition science. 2 large U.S. cohorts, decades of follow-up, consistent direction of effect across replications. Here's the cohort extraction problem, the WU paper, the Zong paper, the Harvard summary that recycles them. None of them publish a subset analysis for adults over 60 specifically. The closest evidence is in adults over 40, which may or may not extrapolate. There's no study that looked at this for the audience this list is written for. That gap is not the listicle's fault. The field hasn't generated the data yet. But the listicle never tells the reader the gap exists. The reader sees a recommendation. The underlying paper measured a population that doesn't quite include them. The breakfast bowl most people already eat probably stays on the menu. The case for whole grains is real. 5% lower total mortality is not nothing. The cohort layer the listicle inherits is missing, and the listicle inherits it because the underlying papers did not measure it. Before we turn to entry 6, the drawback on this one, the Wu 2015 Finding Pooled All Adult Ages, with no published subset analysis for the over 60 cohort. Number 6, Legumes. The 2025 Reed-McCann review in Nutrition Reviews flagged something every senior nutrition listicle skips. There is no published RCT in adults over 60 that directly compares plant protein and animal protein for muscle preservation. Not insufficient, none. The synthesis of the existing trials warned that prior plant protein research used soy almost exclusively, which means any claim about plant proteins generally is doing more work than the evidence supports. To put that into perspective, the listicle says eat more legumes for muscle. The 2025 review says we don't have the trial yet. What is on the table is the 2013 PROT-AGE consensus. That's the Protein Guidance Expert Group, recommending 1 to 1.2 grams of protein per kilogram of body weight per day for adults older than 65 and 1.2 to 1.5 for those with chronic disease. The recommendation is for total protein, not for legume-derived protein specifically. The cohort is implicit. The recommendation works whether the protein source is animal or plant. We don't know why the field hasn't run a legume versus animal RCT in adults over 60 for muscle preservation. We can guess at the reasons, but flagging the gap matters more than inventing a reason for it. Sarcopenia, age-related muscle loss, is real. The eat more beans recommendation may still be sound. The evidence base is thinner than the listicle implies. Before we turn to entry 5, the drawback on this one, Reed-McCann 2025 explicitly notes prior plant protein trials used soy, a single legume, limiting any claim about all plant proteins. Number 5, berries, wild blueberries, and the 2023 Wood RCT in the American Journal of Clinical Nutrition. The trial was a 12-week, double-blind, randomized controlled trial in healthy older adults. That's the gold standard trial design with random group assignment. The wild blueberry polyphenols, that's the plant antioxidant compounds, improved vascular function and cognitive performance. The plain English, short-term mental function got better in the trial group versus placebo. Here's why this entry sits at 5 and not higher. The cohort age band fits the audience. Healthy older adults. That is the population the listicle is written for. 12 weeks, however, is short. The mechanism the trial measured, vascular function and short-term cognition, is real. The mechanism the listicle implies, long-term dementia prevention, was not measured in the 12-week protocol. 12 weeks cannot tell us about a 10-year cognitive trajectory. The Morris map analysis we'll get to has the time horizon Wood does not. Older blueberry trials in this age band exist, with longer protocols and similar short-term signals. The wild blueberry versus cultivated blueberry debate matters less for this audit than the duration question. None of the trials run long enough to test the dementia outcome the listicle implies. The wild blueberry powder you can buy is the form the trial tested. Eating fresh blueberries probably reaches the same target through a different path. The listicle says so. The trial does not quite say so. And that distinction is the kind of thing the listicle should flag. Before we turn to entry 4, the drawback on this one, Wood 2023 ran 12 weeks in healthy older adults. Long-term cognitive outcomes were not measured. Number 4, fatty fish. Compared to the cohort meta-analysis, the randomized trials say something different. Hold that contradiction in mind for a moment. It is the through line of the entire list. The 2023 Way meta-analysis in the American Journal of Clinical Nutrition pulled together 103,651 participants across cohort studies and found that dietary omega-3, that's the fish-linked essential fat, was associated with roughly 20% lower risk of dementia or cognitive decline. The 2023 UK Biobank publication on circulating polyunsaturated fatty acids and incident dementia included 440,750 dementia-free participants, about 500,000 people, and saw plasma omega-3 levels associated with lower dementia risk. The 2023 Salavila paper in Nutrients ran a tighter version of that analysis on 267,312 UK biobank participants and reached the same direction. Then, look at the trials. The 2022 Kang Vital Substudy in Alzheimer's and Dementia gave 1 gram per day of marine omega-3 to participants over a 2 to 3 year follow-up and found no cognitive benefit. The 2017 Alpha Omega Trial Cognitive Substudy gave EPA, DHA, and ALA over 40 months and found the same, no slowing of cognitive score decline. The cohort signal at 20% lower risk does not replicate when you randomize the supplement. The mechanism is mostly dietary fish, not supplement capsules. That is the most generous reading of the literature. The Eat More Fish recommendation has cohort support. The Take a Fish Oil Pill recommendation does not. The fish oil capsule on the kitchen counter is not interchangeable with eating fish. The Healthiest foods list implies it is, while the next food is loading. Here's the frame to hold. Was the study you've already heard of done on adults over 60 or borrowed from a younger cohort? Hold that question through entry 3. Before we turn to entry 3, the drawback on this one. Kang 2022 and Alpha Omega 2017 both found no cognitive benefit from 1 gram per day supplementation. The cohort signal does not replicate. Number 3. Walnuts. Open the 2018 pre-dimed republication, and the cohort description is uncommonly precise for nutrition science. 7,447 adults aged 55 to 80 randomized to one of 3 diet arms: Mediterranean diet plus 30 grams a day of mixed nuts, Mediterranean diet plus extra virgin olive oil, or a low-fat control. The 30-gram daily handful was specified by weight: 15 grams walnuts, 7.5 grams hazelnuts, 7.5 grams almonds. The follow-up averaged 4.8 years. The primary outcome was major cardiovascular events: heart attack, stroke, cardiovascular death. The result: a 28% reduction in major cardiovascular events on the Mediterranean plus nuts arm versus the low-fat control. That is, by current standards, one of the cleanest randomized signals in senior nutrition. Now, the republication backstory matters. The original pre-dimed, that's the Spanish Mediterranean diet trial, was published in the New England Journal of Medicine in 2013. In 2018, the paper was retracted. That's a journal withdrawal of the paper, and republished after the authors discovered that some randomization protocol deviations had occurred. Specifically, in some sites, participants had been assigned to the same diet arm as their household partner, rather than independently, which violated the strict per-individual randomization the original analysis assumed. The 2018 republication accounted for this, and the headline effect held. 28% reduction held intact with revised statistical analysis. Most senior nutrition listicles cite pre-dimed as if 2013 still stood. The cleaner reference is the 2018 republication. There is one earlier pre-dimed finding worth flagging. The 2013 Gouache-Ferré observational analysis on pre-dimed participants reported that those eating more than 3 nut servings a week had a 39% lower all-cause mortality compared to non-nut eaters. That's an observational finding within the trial population, not the trial's randomized arm, different number, different methodology, both published. The mechanism the trial measured was cardiovascular events, not cognitive performance. The trial design did not include cognitive endpoints, mood scales, independence measures, or fall risk in its primary outcome inventory. To put that into perspective, pre-dimed is the cleanest 60-plus signal we'll cite in this video, and it still leaves the audience-relevant outcomes uncovered. The 30-gram handful, measured by weight, not by a coffee scoop, is what the trial used. Whether the same handful, eaten less precisely, delivers the same effect is what the listicle assumes. The trial does not say that. Before we turn to entry 2, the drawback on this one: the 2018 pre-dimed republications tracked cardiovascular events, not cognitive performance, mood, or independence. Those outcomes were not measured. Number 2, leafy greens. The 2018 Morris analysis in neurology examined 960 adults aged 58 to 99 in the Memory and Aging Project. That's the Rush Aging Study cohort, over a mean of 4.7 years of follow-up. The participants who ate the most leafy greens, defined as 1 serving a day, roughly half a cup cooked, showed cognitive decline rates equivalent to being 11 years younger than those who ate the least. The earlier 2015 Morris analysis on the same MAP cohort had already shown that the highest hurdle of MIND diet adherence, that's a brain-focused diet pattern, corresponded to cognitive decline equivalent to being 7.5 years younger. 2 cohort studies, same investigator, same population, and the cognitive decline rate replicated across both analyses with no major contradictions. Here is what makes Morris's work the strongest direct 60-plus cohort signal in this video. Mean age in the 2015 analysis, 81. The participants are exactly the cohort the listicle is written for. The design was observational, not randomized. Morris herself was explicit on this, quoting verbatim, "Does not prove that eating green leafy vegetables slows brain aging. It does show an association. The mechanism is multifactorial: lutein, vitamin K, nitrate, folate, alpha-tocopherol, beta-carotene, chiampherol. And the relevant question is which of those drives the signal. The trials separating those nutrients have not been run in this cohort. Direct 60-plus evidence, big effect size, observational only. That is the strongest evidence we have seen so far, and it is not the top food." Before we turn to entry 1, the drawback on this one, the Morris 2018 MAP analysis is observational, so causation cannot be claimed. Morris herself said this on record. The pattern is now visible across the 7 entries. 3 of the 7 foods have direct over 60 cohort evidence. Leafy greens, Morris MAP, mean age 81. Walnuts, pre-dimed, mean age 67. Olive oil, 28 years of follow-up extending the NHS and HPFS cohorts well into 70-plus territory. We'll get to the cohort extension caveat in a moment. 4 of the 7 foods are extrapolated. Whole grains, Wu 2015, pooled across age bands, no published over 60 subset. Legumes, PROT-AGE consensus on total protein, no plant protein RCT in over 60 adults. Berries, Wood 2023, RCT got the cohort age right, but the duration short. Fatty fish, cohort signal at 20% lower dementia, but Kang 2022, Vital and Alpha Omega 2017, supplement RCTs do not replicate. The reanalysis pile gets larger. The 2024 Tessier paper that opens this video gets added to it. The dementia death extension of the olive oil literature. The 2018 pre-dimed republication is already on the pile. The Way 2023 cohort meta and the supplement RCTs that disagree with it are now on the pile. The standard Healthiest foods list does not run this audit. It inherits conclusions from cohorts that do not include the audience and presents them as recommendations for that same audience. The synthesis the channel is doing is not which foods. It is which cohort, at what age, measuring what outcome, with what duration, replicated by whom. 3 of 7, 4 of 7. The order of the next entry, number 1, sits at the cohort-aligned end of the spectrum, which is why it is at the top. Number 1, olive oil. The 2024 Tessier paper, the first to track olive oil and dementia death across 28 years, was published in JAMA Network Open in May. And Julie Tessier, working from the Nurses' Health Study and the Health Professionals Follow-Up Study, ran the cohort. 92,383 U.S. health professionals, baseline mean age 56, 28 years of follow-up, 4,751 dementia-related deaths recorded. Participants consuming at least 7 grams a day of olive oil, that is roughly half a tablespoon, had a 28% lower risk of dementia-related death compared to those who never or rarely consumed olive oil. The hazard ratio, that is the relative event risk, was 0.72, 95% confidence interval, 0.64 to 0.81. The 2022 Gouache-Ferré paper in the Journal of the American College of Cardiology on the same 2 cohorts had earlier reported 19% lower all-cause mortality at the highest hurdle, the top 1/3 of the intake distribution over the same 28-year window. Different outcome, same cohorts, same investigator group, partly overlapping. Marta Gouache-Ferré put it on record, quoting verbatim, Olive oil consumption has been linked to lower cardiovascular disease risk. The cohort extension case lives here. Baseline cohort age was 56. Only the 28-year follow-up extended this into 60-plus territory, not the original recruitment. That makes olive oil the strongest cohort-aligned signal in the video, while also being the entry where the cohort attribution discipline matters most. The cohort was not designed for over 60 bodies. The follow-up made it 1. The original participants entered the study at 56 on average. Many of them were over 80 by the time the dementia outcomes were recorded. That makes the cohort extension case different from extrapolation. The participants who lived through the cognitive decline window are inside the original cohort, not borrowed from a different one. To put that into perspective, half a tablespoon a day, 28 years of recorded deaths in over 90,000 participants, a 28% reduction in dementia-related death. Add it to the reanalysis pile. The 2024 Tessier paper is the strongest single piece of evidence in this list, and the cohort honesty pass that the standard listicle skips is exactly what makes that strength legible. Here's what stays with us from this audit. 3 of these 7 foods have research built specifically on adults over 60: leafy greens, walnuts, and olive oil. The other 4 carry strong general adult evidence that has not yet been retested for the cohort the audience belongs to. None of that means the other 4 are wrong. It means we are inheriting conclusions from cohorts that don't include us. And we shouldn't be a hidden category in our own diet plan. The fragmentation that turned scattered SEO articles into a healthiest foods list is the same fragmentation that hides which cohort each finding came from. The synthesis is not about which foods. It is about which cohort actually measured this in older bodies and which didn't. Next week, the next video looks at the senior protein RDA and the 2023 reanalysis.